Great, so welcome to the NDS showcase. We've got one item we'll be talking about today, telling the story of a project that it's been a big feature of 2020, and I'm just going to hand over to Blythe to introduce the work.
Great, thanks Rohan. I will do the obligatory screen share in the background, which will hopefully just work out perfectly.
Yeah, that's coming through.
Is that coming through? Okie dokie. So yeah, thanks very much, Rohan. I'm going to talk today a little bit about our work on SMS shielding. And so I've spoken a bit about this, and other colleagues across the team that have been involved have spoken as well. So I'll do a little previously on SMS shielding to get us kicked off. So we through the months of April to August, we were running the SMS shielding service, supporting food box delivery to just under 1 million food box deliveries. We sent lots and lots of messages via the service to support people and keep them informed on latest developments. And we had about 60% of the shielding list signed up with the SMS service, and we were working in daily interaction with our partners across all 32 authorities. So that's the context of where we were in April to August, and as I say, many have spoken in detail about where we were. But in the last few weeks, and featured in today's episode, we've moved on to a new challenge that was raised and brought to us by Scottish Government, which was vitamin D. So this is the guidance from Public Health Scotland on vitamin D. And over the past few weeks, we've been coordinating a call for people on the shielding list to sign up for a 4-month supply of vitamin D over the winter months, because vitamin D is often sourced from sunshine, such as that is in Scotland, but during the winter months, lots of the advice is for really the whole population to be taking vitamin D supplements to promote various aspects of good health. So what we've been working on, Andre will say a bit more on the technical detail that sits behind this, is picking up where we were with the SMS service during that very busy period when we were doing food box delivery, and reused lots of the componentry that we've developed. So we've been able to pick up the service at the heart of things to support ordering of vitamin D. We've been able to restart very active partnership with local authorities. So we've restarted our famed Friday morning call, Friday morning surgery call, to deal with issues as they arise with local government. Build relationships, build kind of peer relationships across that group, so everyone has a collective sense of purpose across that. We've also been able to pick up the significant equalities work that I've spoken about to this group before, around assessing how fair and equal our service has been. So this presents quite an interesting opportunity, because we've run this service and been able to look at the equalities impact that we predicted in our equalities impact assessment documentation, but then we've been able to see whether that's actually come to pass. And we've just been doing some initial analysis on this vitamin D group to see whether people signing up are the people that we expect to. So we've got that to look forward in terms of analysis over the next little while. And this is obviously a very timely moment for this, because the deadline for sign up via the service for people was the 11th of November. So the morning of the 12th of November has been an extremely frenetic morning. Finalising the SMS services sign up, which came in, we had just about 68,000 people from the shielding list that signed up for. We'll be coordinating the data coming in from local government. So local government coordinated the data for people coming through contact centres. So people who chose not to interact with the SMS service but wanted to sign up for the service nevertheless, they could do that by phoning the local authority contact centre. So we expect another 10% or so in terms of people signing up via that mechanism. And then we'll put together those sign-ups, which should take us to somewhere around 75,000 people signed up for the supply. And we'll be into the phase of passing that to our delivery partner to start the delivery of these vitamin D tablets to people over the next period. Also, it's worth saying at this time, while we've been running this service around vitamin D, we've also been using the communication service developed as part of the previous phase. And in this context, where we're into a phase of more granular guidance and advice at various tiers and levels, we've been able to target messages specifically to local authority areas and people on the shielding list in those areas by the various tiers and the various levels of guidance. So splitting up our full shielding list to target communications rather more accurately and directly. So that's been a good reuse of previous work on that within this phase as well. So I'll pass over to Andre at this point, who will give us a sense from the technical challenges and the technical work that was done to support this. Andre?
Yeah, so hopefully you can hear me.
Yes.
Cool. So from technical side, thankfully from the way we left it, it was around weeks of a single engineer's time to enable vitamin D requests. And the work centered around enabling the vitamin D and the variations of that command. So not just vit D, but vitamin D, different cases. But that's quite quick, so we just add that. I guess a bit of a more chunky work. So previously we were handling status messages for people being signed up to the priority shopping list and the groceries, food boxes basically. So that were 4 different status messages. Instead, now we had to return status messages based on whether someone was signed up for vitamin D or weren't and associated instructions. So we also added a report for vitamin D, so we can send that to the people that actually deliver the vitamins. But that's also quite quick. So we're using Postgres as our database for shielding. So it's as easy as writing an SQL query as to what you want the report to say. But I guess the chunkiest bit of work to enable it is actually handling the files from local authorities. So the way we interface with local authorities is through a secure storage place, and they put CSV files basically, which isn't really a standard programmatic interface. So the work involved there is to parse that file and validate it and return any errors if they have errors in those files. So that was kind of the chunkiest work of that. But in terms of enabling vitamin D, that's pretty much it from the technical side.
Great, thank you, Andre. That's really good. So we've been able to get a service that was spun up really quickly in the first instance and reuse it for a similar but different purpose. Again, really very quickly and very nimbly. It's looking like this has been a really good piece of work. We're really happy with of sign. Looks like the process through local authorities has gone very well again. Helpfully, there was a lot of familiar faces from local authorities who are continuing in the role of supporting contact centres and shielding locally, who were able to pick up this task quite readily. We had some new people as well, so we had to do some little familiarisation with those people, but that seems to have gone very well. So we're now sort of thinking about what happens in the next thrilling installment, and this year has been very difficult to predict, but we know at least something will follow. Say a little bit, and then I'll invite Orlando to give a perspective on all of this, but maybe to give us an indication of what might come next from his perspective. But we know that in the next thrilling installment, we will be restarting the service that we had as part of the earlier phase around supporting priority supermarket slots for people on the shielding list. So giving them access to these 6 supermarkets that we're working in partnership with to gain access to priority slots. And we know that we'll be restarting that process in the next couple of weeks. So that's a live issue at the moment. But in terms of future issues, we know that there are other strands of work across NDS, maybe in relation to things like risk stratification, that might consider how the SMS shielding service might support some of that. So there might be an aspect related to vaccinations, I guess, as well. But Orlando, do you want to come in at this point and give a perspective from your side?
Yeah, sure. Thank you very much. And it's really good to join you guys, and also to hear things like the technical side of things, which normally I don't get to hear, and a chance to say thank you for all the work that you've done on this. So from our side, I head up the shielding division in the Scottish Government, and this has been a really incredibly useful piece of work from our point of view, the whole setup of the SMS shielding service, really, because we started off in March last year, knowing there was a cohort out there who hadn't even been identified yet, and about whom we knew incredibly little, really, other than that they met the criteria that the chief medical officers had set out for shielding, and otherwise we didn't really know who they were or much about their behaviours. And so the direct contact with citizens has been incredibly important in terms of us understanding where the policy should go with this, and the SMS service has been really important in that. So we've got various ways of communicating with people who are on the shielding list, and we write letters to them. So proper paper letters, and that has certain advantages that we can go into more detail. We can reach everyone who has the postal address. And the SMS service offers something different, which is much more flexible, much faster and quicker turnaround. Allows us to be targeted by postcode or by other criteria, and also to have that interaction with people. And that's been incredibly useful. So we use that around the food box and around supermarkets, now around vitamin D, and that's really helpful. And where it's worked best, I think, it's where you've used different routes for the same piece of work. So with vitamin D, we wrote a letter to everyone on the shielding list, which had a section on the vitamin D offer, why it might be important, what other things to bear in mind, why you have, whether it was suitable for you, and then we followed up with the SMS service and allowing people to both remind them and to opt in by that route, and that's worked very, very well. And I think the reason it's worked so well is because we're building on basically, what is it now, 8-9 months worth of built up experience and expertise now, and that's both the technical side, which feels now relatively mature for such a young service. But what's been really helpful from us as well is that I think the team at NDS has developed a really in-depth understanding of the policy and our outcomes that we're working towards. And also because obviously the SMS service gets back a lot of replies from people, often unsolicited via SMS. You also get a lot of first-hand feedback from citizens, which just adds to your understanding of what they need and what their concerns might be, and essentially how we can strengthen the policy. And I think that's been one of the really great things from our point of view, is that we don't just come to you, and I'm sure you're very relieved about this as well, because you know better than us what you can do, but we don't just go to you saying we need X, Y, Z. We tend to come with an idea of what we might need, you give us your feedback, we refine that, and we're doing that because we've got a shared understanding both of the citizens and also the crucial relationships, and that's the relationship with SG, but also the relationship with the citizens and with local authorities, and that's built up over time and is really good now. So in terms of what the future might hold, as Blythe said, we couldn't necessarily have predicted half the things that we've done so far. So moving from food boxes, supermarkets, it's likely there'll be something around risk stratification. Certainly as different areas move through the levels, there's something about communicating to people and helping them understand the changing advice in their areas. But there's also stuff that comes out of left field. So I've just come out of a call, for example, with the team in SG that does elections, and they're quite concerned about how we support people who are at highest risk from COVID to vote safely in Scottish Parliament. And again, that direct contact with citizens, I don't know quite in what form yet, but the knowledge that we can engage with citizens very directly and have an exchange, whether that's around proxy voting or postal voting, whatever it might be, that just gives us a great flexibility and a great basis for continuing wherever this policy will go in the future. So it's been a really exciting piece of work from our point of view.
Brilliant. Thanks very much, Orlando. And yeah, the future is definitely unpredictable, but there's some really good opportunities for reuse of the service. I suppose just as a sort of joking end, it's just having the supermarkets on the screen there, is that if you'd said to me, or you'd said to probably anyone in the team 12 months ago that we'd be working on a collaborative project with Iceland, I think most people would have assumed that we were talking about the country and not the supermarket. And I don't think it should be understated the way that we've developed as part of this service, that partnerships with some of the more parts of the system, the way that we've been able to broker data sharing agreements, and this is good work from Steve and Doug and others, to get information flowing appropriately and safely and in well-managed fashion with supermarket partners, with delivery partners of lots of different types, has been remarkable. The way that the sign up for these data sharing agreements, even between health and local authorities, has progressed really swiftly and with a really good level of accuracy, has been remarkable. So there's lots of really good learning across this piece of work that we're sort of taking for granted now because we're in amongst it. But if we take just half a step back, there's remarkable progress and remarkable strides that have been made with this work. So that is all from me. So thank you very much.
Yeah, thank you, Blythe, Andre, and Orlando for that. And I guess that concludes this showcase item. So yeah, look forward to hearing more in the future.